So,
Good evening, and thank you for joining us here on blackdoctor.org, Facebook Live. I am Ellis Dean, the Director of Programming and Production here on blackdoctor.org, and we have a great program for you tonight. So as many of you don't know or you didn't know, May is Women's Health Month, right? And so we've kind of expanded it out because, I think, Dr. Yolanda, it started off as Women's Health Week. It was that week after Mother's Day, but we said, no, you know what? Women deserve more than a week. We're going to go give a whole month. And so this is Women's Health Month, the last day of Women's Health Month, but it is still Women's Health Month, and we are here to talk about women's health. So if you're just joining us, our friends at Walgreens are wonderful partners as part of this production, but we're going to talk about momming time. So all of you mothers out there, this show is specifically for you. This is about your health as a mother being the foundation for your entire family. So we've got some great guests to come on with us tonight. We've got Dr. Yolanda Lewis Ragland. Y'all know Dr. Yolanda. She's no stranger to Black Doctor, and she is she's double board certified as a pediatrician and a bariatrician. For those that don't know, that is for people that deal with like obesity and things like that. So that's what she does. And so she's also a mother. She is uniquely positioned to be on this program today to kind of talk about both the health as well as the motherhood side of the situation. And then we've got another guest that's going to be joining us a little bit later, and she's going to be talking about she's a mom. She's a hardworking mom out there, and she's going to be talking about some of the challenges she has as being the chief medical officer, the medical center for her family, as most mothers are. And by Dr. Yolanda's response, I can see that she is absolutely agreeing with that piece. And then finally, at the end of the program, we're going to have a couple of guests that are going to come on and give us some tools and tips and give you some tools and tips on how to make that process easier. Because as we know, your health is central to being able to extend out and be that person for your family. You've got to be healthy as well. And that's why we say your health is the foundation, because if you're not healthy, how can you help the rest of your family stay healthy? So I know you didn't sign on to hear me talk. So Dr. Yolanda, how are you doing this evening?
I am well. I'm so glad to be here. This is the last day of May, as you said. And what I love about May is it's not only Women's Health Month, but it is Mental Health Month. And yes. So for me, I often talk about how the two are so integrated because we as women, and especially we're talking today as Black women, we're just dealing with so much. All of us are. But particularly when you're, taking care of family members, taking care of homes, many of us are in that sandwich generation where we're taking care of children and we're also taking care of our parents, or some other loved one that's older, and we gotta care for them as well. So we have a lot happening. So, but I'm glad to be here. I had a busy day, of course, but I was so excited that this is how I was going to end my day. So thank you for having me, and especially when it comes to a topic like self-care. That this is one of my loves. So I could not pass up the opportunity to have this conversation. So.
Well, absolutely. We're going to make this the easiest hour of your day. So a couple of things for people that are watching us right now. I want to ask you, number one, drop in the comments. Let us know where you're watching from. We always like to see where people are watching us from around the country. Also, number two, if you know somebody that can use this information, tag them on Facebook and say, hey, you need to be watching this program right now. So send them a tag. And finally, if you have any questions for any of our guests, please drop that in the comments section as well, and we will get to your questions as much as we can in the time that we have allotted. So those are the three things. Tell us where you're from, tag a friend, drop your question. All right. First question for you, Dr. Yolanda, is, as a healthcare professional, what do you think? What are some of the major issues, health concerns, health and wellness issues that are facing Black women today?
So Black women are uniquely overburdened by several physical conditions as well as mental health. But specifically for us, we have reproductive issues like fibroids. We're really the amount of fibroids that Black women face is much more than other ethnicities. Um, in terms of our other things about reproductive health with us, often breast cancer is actually pretty high in Black women. And a lot of times it doesn't even have a genetic marker, so you can't always sort of predict whether or not it's going to be a part of your family history. I mean, it's not always a part of your family history, so you can't predict whether or not it's going to be your fate. And uterine, ovarian, we have just a lot of cancers, and I could obviously there's a conversation to be had, because many people often want to only associate diet with that, and maybe exercise or certain elements that we're consuming. But the reason I do my show, Mind, Body, and Stress, is because stress and stressors in our lives is so much higher than most, right? Because we have that double whammy. We are struggling with the marginalization of communities of color, but we're also struggling with the marginalization of women. And so we're sort of at the lowest of this, of this totem pole, if you will. But those are some of our reproductive health concerns and issues that we face. Obviously, things like obesity, diabetes, heart disease. Heart disease is, the number one killer of all American adults in the country. But it is a particular burden in the Black community. And interestingly, it used to be that Black men were more affected by heart disease than Black women. You always thought about Black men and their hypertension and some other concerns that they had. But the one place that we have equality is in heart disease. And I'm not sure I want equality in heart disease, right? So that's the one place where, we have just as much, if not having surpassed Black men at this time, but we have just as much heart disease as Black men. And a very interesting statistic from the American Heart Association is that 49% of Black women have heart disease by age 20. The reason I got so involved in heart disease as a pediatrician is because so many people don't want to talk about heart disease until we're adults, in our 40s, 30s, 40s, 50s. But if it's 49% of us by age 20, then that means it's happening to us as preteens, as teens, as young adults. And a lot of that, again, is the stress. It's not just our diet and our exercise. And then, of course, there's mental health concerns like depression, anxiety, schizophrenia. We're actually pretty high on several of these diagnoses when it comes to mental health. So, and one that I know a lot of women that are dealing with is some fibromyalgia, but also multiple sclerosis. You'd be surprised. It's actually a lot of multiple sclerosis as well as lupus that is sort of experienced in disproportionately in Black women for the percentage of the population that we actually comprise. We have a very high burden of these chronic illnesses, these diseases, and many of them are exacerbated by stress.
So we talked about stress, and we're talking about a little bit, and you brought up something about self-care, right? And so when we're talking about health and wellness, I think so many times people want to separate self-care and health and wellness. And so kind of help people understand why health and wellness should be the center, if not the foundation of your self-care.
So absolutely. So I always say, so September is self-care month, by the way. I say this all the time. I'm always ready for September because I come up with all kind of fun things to do. And this September, I'm actually going to be on a retreat in Bali for my self-care month. So I think that we don't recognize that self-care is healthcare. I say this all the time, that when you are taking care of yourself, and I even consider going to annual visits a part of self-care, simple things like taking time to have a whole routine for washing your face, masks and massaging your face, and just really taking time, because half the time we're in such a hurry, we're splashing water on our face, we're brushing our teeth as fast as we can, and we're getting out the door, and we're not really spending time grooming. And so grooming can be self-care. Anything that you do that you slow yourself down and you're intentional about can become a part of your self-care routine. But
Mhm.
self-care in terms of health and wellness is extremely important, because what you recognize when you really purpose yourself to care for self, it's just like, you made the comment, we can't take care of others, we got to take care of ourselves. It's basically I say this all the time, it's the pilot's instructions. That pilot says every time you get on this airplane, he says, if you feel turbulence, if something goes wrong in this airplane, and we, give you the signal, we need these oxygen masks that are going to drop down. We need you to put yours on first.
Right.
And then you're going to help whoever is accompanying you. Well, that's what self-care is about. If we're not taking care of us, if we're not taking care of ourselves, then how can we be a good employee, a good spouse, a good parent, a good daughter, friend, whatever it is, whatever role you're playing in life, and you're playing a role no matter, none of us are an island, none of us are by ourselves. So you may not be a mom. I was thinking about that concept that you were, as we're talking about moms, but you're nurturing someone. You're a
Mhm.
nurturer. Most women just are natural nurturers. So you may be auntie, you may be, big sister,
Right.
whatever you are. But what happens is we have to value ourselves enough that we put the time and the energy into us. And when you value yourself and put that time and energy into yourself, you're actually teaching others to value you too. Oftentimes
Mhm.
we're so big on being sacrificial. Where big mama, cooks for everybody, and that's her, love language, and does all of these things, and you come in, oh, let me get that for you, baby. And I appreciate all of that. But what it ends up telling us is that person who does all that caring for everybody else doesn't necessarily need anyone to care for them. It's very seldom that people will sort of reciprocate that kind of care, because they've just gotten used to, this is what she does, this is what she likes, this is how. Well, I keep saying this is a different generation. We have gotten, the grandparents aren't with who they used to be. So, grandparents now are traveling, they're out, they're doing things. So the parents who think they could drop their kids off at grandparents' houses now are like, huh, wait a minute, y'all are out and traveling. But now we have to begin to teach others how to treat us. And the way you do that is you develop a self-care routine. And everybody knows, I used to do hot yoga when I was my 30s and 40s. I would come home and I would hurry and grab my bag, and my kids knew I was going to be gone for 2 hours. It was a 90-minute class. And so if they were doing something and I went to grab that bag, it was an automatic, oh, we're not going to see mommy for a couple of hours.
Okay.
And it was not pulling on me. In the beginning, they used to pull. I would get a phone. I'm in the car on my way, and the phone would ring. And my son would say, well, you left? And I say, yes, I left. I grabbed you see my bag is gone, right? So that became the signal. When my bag was gone, I was going to, my yoga class. That was a 2 hour. There were ways in which they realized, okay, this is what mommy does when she, is her time to herself. There's no calling me. It better be a 911. Somebody better be bleeding out. But we have to learn to protect ourselves and protect our time, and value ourselves enough so that we can then teach others around us to value us as well. And I think it's I think it's great because we teach our daughters to do that when
Mhm.
they see that example, and we teach our sons to have that understanding that their wives or, significant others are going to need that time. You have to model it for them to see what that looks like, so that they can expect to either do it themselves as an adult when they were young ladies, or as a young man to recognize, oh, you know what, my wife's gonna need some time to herself. I'm gonna need to like treat her at times. I'm gonna need, so there's so much that we need to start doing to model these behaviors, so that our young people can actually begin to start early. Many of us are starting this late. We're starting to do self-care, in our 40s and 50s. These millennials are doing self-care in their 20s. They are going off on trips. They are spending time with girlfriends. And I love it, because I think that we have actually brought to the forefront, and the pandemic brought to the forefront, that if you don't take care of yourself, if you're not building up your body. When I say your body, I don't necessarily mean bodybuilding. But one of the things I talked about throughout the whole pandemic is we were waiting on a vaccine. We were waiting on a vaccine. But what were we doing while we were waiting on the vaccine? If you were smart, you were actually eating healthy, building your immune system and your resistance by eating a plant-based foods and plant-based meals. All of that stuff actually increases your immune system. It boosts your immune system. Not eating too much sugar, drinking plenty of water. I got on here and the first thing I said was, it's hot today. It was 96 degrees here in DC. And I'm on my second one of these. So I do a gallon a day anyway, but especially when it's hot. So there's all these things that we could have been doing. I hope that people were doing, and I was out there championing that people should have been doing while we were waiting on a vaccine. So now we have that, but I hope people haven't forgotten all the other things that you can do to continue to build your resistance, build your body. Make sure you're exercising, walking daily, exercising daily, getting enough sleep. Lord knows sleep is so important. It builds your immune system as well. It actually helps you with enzymes and hormones that tell you whether you're full or not. I'm always talking about obesity and weight, but a lot of that weight gain was because people really, their circadian rhythms were off. They were staying up really late. They had no schedule, right? They were teleworking. So now all bets were off. They can get up and do what they wanted when they wanted, and their circadian rhythms were off. So you have to actually set yourself for a good schedule, get that sleep, get that water, eat plenty of fresh fruits and vegetables, lean proteins, drink lots of get lots of sunlight when you can, because again, most of us are vitamin D deficient. There are actual things to just tick off. It wasn't all about the vaccine, but now we add that to it, and you can actually make sure that you're healthy and that you're actually thriving through this pandemic time and not just surviving.
All right, well, there's a lot to unpack there. So we're going to make sure that we talk about, we're bringing about health and wellness. So if you're just joining us, we are here. We're talking about mommy time and talking about your health being the foundation for the family, because we all know that most mothers or women in general are the caretakers of their family, the medical directors of their family. And so therefore, we're talking about how they got to take care of themselves first. I love the analogy you gave about the pilot's instructions. Hey, put your mask on first before you try to help others. And so that's what we're trying to teach you here tonight here with our friends at Walgreens. So we're going to bring in our next guest here. This is Michelle Lee Clark series. I think I said that right. Did I say that right, Michelle? Okay. All right. So
Yes.
okay, perfect. So Michelle is a mom, and so
yes,
as a
you
mom,
did. Yes, you did, Alice.
there seems to be a little bit of lag, but we're gonna work through that. So, as a mom, what are some of how much time do you spend thinking about the health and wellness of your family?
That's a great question, Alice. And yeah, there is a bit of a lag, but we're going to work with it. I was taking copious notes that Dr. Lewis Ragland was giving, because I was saying yes in the backstage. Yes, absolutely. And when it comes to the family, it's making sure that we have time to exercise, to take care of ourselves. We're all black belts. My husband and son are second degree black belts. I'm a first degree black belt. So physical activity and taking care of self is very important.
You know, you had an interesting story about your son and how health and wellness became a priority for you, and it became basically through your son. You want to share that story with our audience today?
Yes, Ellis. I grew up in New York City, so physical activity growing up was playing indoor volleyball and playing handball. And then when my son was born, we decided to put him into martial arts, and that's what actually gave me the motivation in my 30s to really up my game in terms of physical activity. So it was basically what was discussed earlier about model behavior and making sure that you're setting an example. How can I say to my son or to anyone else, oh, yeah, you should do this if I'm not doing it myself?
Absolutely. Absolutely.
That's a great point. So this question's for both of you, and then we're going to bring in our third guest to kind of give us some help us develop some solutions for all of these challenges that we've been talking about. But there's a narrative that's out there. It's in the media, it's within the community, and it's that narrative of the strong Black woman. Do you think that narrative is impacting the health and wellness of Black women by making them kind of recede from that, I don't need help, I'm helping others, I'm good, I'm a strong Black woman, and you think that's impacting the health and wellness of Black women in general?
Well, I will absolutely say yes. I talk about this a lot, in fact. So one of the things that I say all the time is that it's this idea of Black resilience, is what I call it, right? So we talk about Black resilience, and I feel like we need to change the narrative of Black resilience because, as you're saying, for so long, Black resilience is, what doesn't, what is it? What doesn't kill you makes you stronger, right?
Right,
What doesn't kill
right.
you makes you stronger. You can pull yourself up by your bootstraps. Black don't cry. Like, we have all of this stuff, and it's all great and wonderful, and they're affirmations in these ways, Black girl magic. But when you're not doing well, like during the pandemic, or when you're having a hard time, or when you're struggling a little, um, all of these things that are being said to you, joy cometh in the morning, all of this stuff is like, it really is teaching you to just push through. But what it doesn't teach you is to recognize when pushing through is not the healthiest thing for you, when you actually need to reverse or take a moment, take a break, and find out, what kind of help do I need right now? Because we often don't ask for help because we've been taught we don't need it. And then when you start to have issues of some sort, you really are you're blaming yourself. You start victimizing yourself. You start telling yourself, Black women don't need mental health care. We don't have time for that. Who has time to break down? We've had, people say things like that. Who has time for that? But in other societies and other cultural groups, that's not what is done or said. They actually take the time to care for each other, support groups, get mental health. And so I just think that you're so right. I definitely think it's hurting us. I think that it's just a double-edged sword. I believe it's meant for, you know, for motivation. And I do believe we are strong. I don't think that we're not strong, but the problem is, when you're not feeling so strong, you shouldn't feel guilty, or it shouldn't be looked at as though you're failing, in some way, because you're not strong 24/7, and just to your point, when it comes to that analogy, we were talking about the, what's this thing called? The mask, the oxygen mask. The other analogy I like is that, you have a cup that you're filling other people's cup with, right?
Mm-hmm.
And there's two ways to fill somebody else's cup from your cup. You can poke holes in your cup, and then fill everybody's cup, but then you're empty. But the best way to fill your cup, their cups, is to fill up your cup. And that's what self-care is about, filling up your cup so that you're really filling from the overflow. So the idea and the concept is we are strong, but we need to know what are the things that we need to continue to do to continue to build ourselves up when we're not feeling so strong. So I do think it can sometimes be detrimental to us.
Michelle, did you want to add
I,
anything there?
I agree. I agree wholeheartedly with what the doctor has just said. And to add to that, when perhaps there are moments where you're not feeling 100%, as an executive career coach, I tell my clients, what conversation are you having with yourself? If it means that you need to take a moment to take a step back and reflect, ask yourself, have that conversation with yourself. I do it all the time. Michelle, how are you feeling? I ask my girlfriends, I ask anybody, basically just checking in and making sure, well, what is it that perhaps is making you feel at the level that you're not at your optimal? So having a self conversation, I think, is one of the most important first steps. Before you speak to anybody else, perhaps talk to yourself.
Absolutely. So we're going to bring on our next guest to kind of help us kind of devise some solutions that moms, or even if you're not a mom, but if you're a caregiver for somebody, or even you just need to take care of yourself. How about that?
You're a caregiver for you too.
You got to care for yourself too. So you got to care for that person that's looking back at you in the mirror. And so we're gonna bring on our guest here. And this is Dorothy Loy, and as you can see by her name, she is both a mother and a pharmacist. So thank you, Dorothy, and she is. So Dorothy, you've been hearing this whole conversation. Go on.
I have, and it rings so true. For you could be a mother, a sister, a daughter, it doesn't matter. But it's all about taking care of yourself. If you don't do that, you're not taking care of others. You just can't. So I love the conversation. Yeah, cheers to the strong ladies out there.
Absolutely. So what are some of the things that some of the opportunities or tools that Walgreens has that can help some of these moms, and especially young moms that have, maybe multiple children, they may have their mother there in the home with them. What are some of the tools that Walgreens offers that can help them juggle all of these things to make sure everybody's healthcare is taken care of, maybe multi-generational, including their own?
Yeah. So it's all about saving time, honestly, for a lot of people, right? Like, how do you save that time so you can take that time to nurture yourself, to do that self-care that you guys were all talking about? And I would say it starts with kind of the app or the online systems that we have. One, they're easy ways for you to manage your own medications and what's going on in your own life. So if you want to know kind of what immunizations do I still need to get, or what immunizations do my family need to get, you can go on and find out easily through our app and through our online accounts. But you can also manage your family's account. So you can attach your children or your loved ones to your account, and you can manage all of them in one place. It makes it a lot easier for, again, that mom, that daughter, whoever, to kind of have one place to go, not have to sign in to different places. Makes it easier and faster. It's also kind of nice because in the app, you can choose how you want to get communicated with and how you want to get your prescription. So if you want to come into the pharmacy, or maybe you want it delivered, because that's just easier. Everyone can choose what works best for them, which is really great, because not some people really want that in-person interaction. They want to bring their kids into the pharmacy, maybe to be able to hear the conversation. And others want it delivered, and that's okay. So it's nice that you have those options and kind of that one central place to go.
Absolutely. It's kind of funny. So I'm asked this question kind of more for myself than anything else. Because, whenever I would go and pick up a prescription, I would rush through that statement that says, do you have any questions for your pharmacist, right? And most people rush through. I see Michelle checking her head up and down. We rush through that because we just try to give me my bag so I can go home, right? I just want to go home. But what if I have questions later on? Like, how do I reach back? Can I reach back out, or is it I'm just stuck, and hopefully maybe Dr. Google will help me figure it out?
Yeah, no, that's a great question. So we actually have a pharmacist available to answer most medication questions 24/7. So there's a pharmacy chat feature. It's available in the app or online, wherever you want to access it. And it's a live pharmacist here in the States that can answer any question about the stores, pharmacy, your prescriptions, non-emergency questions, medication related questions, allergy reaction questions, side effects is a lot of things that we get. And other OTC options, because that's a big one too. We have a lot of different other medications that aren't always prescription, and people have a lot of questions of, can I take this? Should I take it? When do I take it? So it's great to have that option, and it's good to know that those chats are secure and confidential, so no one else sees that conversation other than you and that pharmacist.
So we can ask you questions about OTC stuff too, like Tylenol, or I don't want to put any brands, like any other types.
Yeah. Like what pain medication is right for me, or what's right for my kid? They just had, I don't know, an allergic reaction to peanut butter. What should I be giving them? Things like that.
I was actually going to say for moms, that's actually a really great option. And I will say, as a pediatrician on call, it's great to know that they can call the pharmacy. And I'm going to start letting people know, you can call the pharmacy. But I just think that is a great feature to be able to, as a young mom or a mom who, has, lots of kids that they're taken care of, to know that you can actually reach back out to the pharmacy through an app. This is new to me. I'm glad I'm actually learning something. So I can actually tell my patients this. Yeah.
I'm a pharmacist, and it was 2:00 in the morning and my kid's coughing, and I just want to make sure that I had the right dosing. So I chatted in and I'm like, I think it's this. And they confirmed, and they're like, yep, you're right. And so, when you're going through that, you just need someone there to kind of confirm, or to tell you, like, make you feel better about what you're doing. So yeah, it's great.
Yeah. I can't tell you, as a parent, I can't tell you how many times, and I was one of those kind of not knowing what I'm doing dads. And so when the kids are sick, and is it Tylenol? Do we alternate and other stuff? It would be nice to have somebody that we could reach out to, because it could cause some conflict. I'm just speaking from personal experience. It could cause some conflict if somebody says, what are you doing? Like, you're being useless right now. And I'm like, and I'm going through the old sayings of, well, they'll be all right. It's not life threatening, kind of situation. And like, no, moms don't, that's not their ministry, as some folks would say. That's not their ministry. Their ministry is, they want their child is sick, they want them well. And so we've got to have some tools and some options available for them to lean into, other than dumb dads. I'm just going to speak on behalf of dumb dads out there.
We like dumb dads too. We do. We like any dads that are involved. To be honest, what I was thinking of that you were about to say, or that I love, is when you were talking about how moms react. What I love about being a pediatrician is that parents, particularly moms, but moms and dads, they'll do for their kids what they won't do for themselves. So they are serious about the visit that they're supposed to have, what their vaccines are supposed to be, what medications. I'm getting a call, the prescription wasn't there, I'm on my way to the pharmacy. But you talk to adult docs about their patients, and they're like, they didn't get the medicine. They decided they were going to wait. They didn't feel like starting it. But that is not the case for kids. So I love how moms and dads, they really do rally around, the health of their children in a way that they don't even rally for themselves. So it's very interesting.
So Dr. Lloyd, talk to me about that. Do you think that there will be some residual effects by somebody like kind of leaning into like the Walgreens app? You're talking about how you can connect your whole family in this one space. Maybe they say, okay, now maybe I can take care of myself, because one, it's more organized, and B, I'm trying to be an example for my children to say, okay, your health and wellness should be important to you throughout your life, not just when I'm here making it important, taking you to your appointments.
But I think what you're saying is great. I think what you're saying. So to me, it's a couple of things that I like I said, honestly, this is like my new tool. I'm going to start saying like, because what it does a few things. One, it organizes you, right? And anytime you're organized, you're going to have more time to do other things. That's one thing. Two, it empowers you. That's the thing that you really need as a parent. because everyone doesn't have Dr. Yolanda that they're calling up. And, there are so many people I know that can't reach their physician or can't reach someone, or they're trying to call a helpline at a hospital. But if we know now that it's specifically about medication, then it makes more sense actually to call a pharmacy or the pharmacist and ask them these questions. Then now you can sort of delineate, if I have these questions, I'll ask the doctor. But if I have these questions, the medication question, I'll ask a pharmacist. Mind blown, by the way, right now. I'm just so glad that I learned this tonight. But the other empowering piece is I have a 22-year-old about to turn 23 who literally now is on her way, has to get an adult doctor, I've been pediatrician all this time, and she has to have her last physical. And when they do watch you organize and utilize these tools, this is now something that the teens will begin to utilize for themselves, empower themselves. And it just definitely is this all together in a family setting. It is great to know that this tool could organize you, empower you, and teach. And like we were talking about modeling behavior, it teaches them just sort of how to take charge and just how to be sort of in control of their own situation, and not have to call mom and say, because I've had that phone call, not just my patients, but mom, how many Tylenol am I supposed to take, or how many this, and I'm like, really, right now you don't know. But to know that I can say, if you actually have any questions, that's what you do. But I think that's very good, because you're modeling just how to sort of start taking care of yourself, and this is great. Great.
Dr. Laura, I see you smiling there. I see you.
Yeah, no, I mean, I think about all the other tools that are there too, like things like being able to sync all your medications so that you only have to go to the pharmacy once. You don't have to go 3 different times in the month. It saves so much time. And that's something for, the parents, but also something that you can model for your kids of like, how can they be efficient? How can they kind of manage this? And the other thing you reminded me of was the ability for you to go on and see all the immunizations you've gotten. That's super important, especially for students or young adults trying to go to college or go somewhere else. Like they need to know that info, right? And or how do they make sure that they're, whoever they're working with, they already know that they've gotten that. So COVID, for example, like making sure you've gotten the vaccine. Sometimes that's required places. So it makes it easy because it's all there. It's all in kind of one place for you or for your kids to be able to utilize.
Mm-hmm. Michelle, I see there's a lot of agreement there. What are you thinking about? Let me take you off mute. You're on mute there, Michelle. Hold on. All right.
Am I off mute now? Oh,
you're off mute.
Yeah.
Okay. Now you're back on. All right. How's that working? Okay. You're good.
Thank you. I think it's a great tool as well. I think it helps individuals when they need medication. However, for myself, right, like I recently had a dental procedure, was able to get my medication to ease a bit, but I certainly didn't intend to stay on the medication more than normal. So I think it's a great opportunity to get the medication as soon as you can, right? But also being mindful that it's just part of the process of recuperation and not to be fully dependent on it. Does that make sense, Dorothy?
Yeah, makes complete sense. But that's also the kinds of questions you can ask the pharmacist and talk through and say, hey, I've got this pain and now it's at a 4 instead of an 8. And, the doctor said I could probably do something over the counter, but I don't know what that should be or what that looks like for me because I've been on these other meds and so those are great examples of questions that just make sense to be talking about with your pharmacist.
So I have a question. Yeah. And that is, because I think this is important for people that should know. Sometimes people get medications, they'll get a prescription, and like Michelle was saying, they may not need all of it. Say they got 30 days of it, and it's a pain med. And really after 2 weeks, 3 weeks, they were no longer in pain. And they still have these meds that are expired, and you don't want to just throw them away or flush them down the toilet. So do we bring those back to the pharmacy, or what do you do with that, right? These are things that people don't think about talking about, but I've talked to my families about it. But I think this is a great thing that, you know, maybe we hear from a pharmacist, because I'm always
Yeah.
a physician, that you should
That's
probably.
actually
I think that's a great.
It's a really good question. That's a big reason for sometimes, you know, children getting a hold of medication when they maybe shouldn't because they didn't realize, they think it's candy, who knows.
You know,
But the pharmacies, a lot of our pharmacies have what's called a take back program. And so we take back the medications that are expired or that you no longer need or you just don't want in the house. And so there's a lot of, in our pharmacies, you'll have bins where you just kind of put your medication in there. You don't necessarily have to talk to anyone. You don't have to, you know, if you don't want to explain yourself or anything like that. In some cases, you can ask the pharmacist, you know, do I need to do anything special with this? And they'll let you know for that specific medication, or if it's an empty container, what to do or how to dispose of it appropriately. So yeah, a lot of our pharmacies have that take back program, which people rely on when you get, you know, maybe someone that you're taking care of and now they're switching regimens. And, you know, how do you manage that?
And I'll say one big one that happened recently is, you know, family members pass. You know, you have a family member who is on a lot of medications, and then that family member dies, and you're cleaning, you know, the house, you're just getting all the stuff, and they have all of these meds. And I'm always telling people, this is what their pharmacy is for. And I say all of this, and I'm all excited about it because as a community physician, I am so, you know, I think I'm very excited when people use their pharmacy as a community pharmacy, right? Like your pharmacist should know you when you walk in, or a couple of people that, you know, they know me and they know me and my kids, they know who's going to get what. And so we really do want to treat them in such a way that, you know, you're able to ask questions and ask advice and all of this stuff. So I think it helps build community as well, if they start using their pharmacists more in these manners in which you're suggesting tonight. So I love this.
So let's meet another pharmacist. We have Melanie Owens. She is a pharmacist, and she is joining us as well this evening. Thank you, Melanie, for joining us this evening. I know you've been watching part of this discussion. Is there anything you want to jump in right now, or we could ask you some questions? Anything you want to kind of mention about some of the organizing tools that Walgreens offers, or what you're seeing as a pharmacist?
So like she said, a lot of times we do have people, you know, whose family members have passed away, and we do advise that they, you know, are diligent about removing the patient's information off the bottles before they dispose of them. Or, you know, like she said, just making sure they remove everything at home. A lot of the Walgreens do have the bins that are outside of the pharmacy, so you don't have to interact with people. You can just come up, make sure all of the information is off, and stick those, you know, empty bottles or pills in the bins, and they'll be disposed of properly.
You know, Dr. Lewis Ragland just made some real good points about getting to know your pharmacist. Do you find that having a relationship with the people that frequent your pharmacy works better? That they tend to be more adherent, because that you know, I consider it to be like a triangle, right? Whereas you've got the patient at the top, and then you've got your primary care physician or whomever your doctor is, and then you've got your pharmacist. And your pharmacist is an important piece of that triangle to make it connect, because if your doctor is prescribing medications for you, the pharmacist is really that person that you can rely on to ask more serious, detailed questions about that medication per se, because doctors prescribe a lot of medications, but the pharmacist really has specific training on being able to give information about that medication. And so do you find it's better that do you find that people are trying to build a relationship with you, or are they just come grab their bag and go?
No, absolutely. You know, I'm one of those people who are always standing behind the counter, you know, waving and saying, "Hey, how you doing?" And, you know, asking for you to come ask questions, advising that if anything is of concern, or if you just want to say, you know, hello, or introducing myself, especially at new stores that I may go to. You know, that definitely helps with the situation. We make a lot of phone calls every day, and, you know, I know that I personally try to reach out and make sure that I stay focused and, you know, put big emphasis on making myself available, because it is, you know, a lot of times more easier to reach the pharmacist because we're right there in your convenience store to, you know, come and ask questions, verify that, you know, hey, am I taking the right medication? Am I doing the right things? Am I using these devices properly? You know, and we're there for that. So, I mean, I think it really helps when you feel comfortable enough to come and say, oh, Mel's back there, you know, let me ask her a quick question.
And you have more time a lot of times. That's what I like about it. You know what I mean? They come into the physician's office. We have 10 or 15 minutes, maybe 20. So I think it is a great idea that they have more. I think they have more time that they can actually really ask all of those questions that they want to ask that sometimes we just don't have the time to address. So I think that's awesome.
Exactly.
Okay, so I'm having all these questions. I'm like, oh my gosh, because it's such a great, I'm like you, Dr. Yolanda. I'm like, I'm freaking out because I'm like, and I'm thinking about today, right? So you said you have a 23-year-old child. I have a child that's 20 years old. And this whole generation, I got another child that's 14. And this generation, they utilize apps at a much different rate because I was a fully grown adult male before an app started coming into my life. And so I was like, yeah, okay, they're cool. I like them as organizing tools, but and they are a part of my life. But for this next generation, that's all they know.
Yeah.
And so having an app like this is so like involved that they can put all of their, like, they can help them manage their health and wellness. Just seems like a no-brainer because they're gonna gravitate to that more so than just maybe that person-to-person interaction or that picking up the phone like my old Gen X folks would do, and pick up a phone and try to call and get somebody. I need a live person on the line. No. Go to app. There's a live person there.
I'm yelling at the phone half the time. Representative.
There's a live person that's available for me on this app at any time I have a question. So it's midnight, 2 in the morning, whatever. I don't know why I'm up at 2 in the morning, but I could be up at 2 in the morning. I can reach out to a pharmacist, and I think that is personally cutting edge and pushing us to that generation where, hey, apps are part of our lives, and it just makes sense to have an app to help you with your health and wellness.
Well, I think the whole 2 o'clock in the morning thing, if you think about it, is the person who's in pain, right? Or the person who is uncomfortable and they have discomfort. And who are they going to call? Or who, they're waiting on some on-call doctor to call them back, or they're trying to determine if this is something they need to go to the urgent care for, or do I need to go to. So I actually, as you're saying that, you're calling out that time of night or morning. I think that's the perfect time to be able to get on my computer, get into a chat with a pharmacist and say, hey, my 4-year-old is doing XYZ and we started this medication and they can't keep it. It doesn't seem like they're keeping it down. Do I need to do this? The pharmacist will at least be able to maybe be the first person that might respond. But I think that's exactly who's up at 2 o'clock in the morning. It's the person who's having a hard time, because of they're in pain or they're uncomfortable. So
yeah. If you got a child that's teething, you got a child that's got some colic going on. I mean, there's a great many reasons that especially for parents to be up and having somebody that they can reach out to directly and ask some questions if they're having some pain. Hey, I've got this prescription, but I need to take more. Is it safe for me to take more because I'm having more pain than what the prescription is? They can reach out to their pharmacist or to a Walgreens pharmacist, right? That's also there available to them, so they're not alone in that situation, or potentially could be making a bad decision with regards to their medication. And so, we'd rather have that.
And I think it has a lot to do with also the expertise and the trust, knowing that this is like a trusted resource versus, I can go Google anything and Google will give me lots of answers back. And you never know. Sometimes they're contradictory and you're like, which one am I supposed to believe? Right. Versus like going in and either talking to the pharmacist or just finding some disease state resources, specific to diabetes or vitamins on the website. You can feel a little bit more comfortable that it's like it's trusted and it's been verified, and that this is someone that I can lean on, and they got expertise in this area. So
if you're just joining us, I don't know why. If you have to go back and watch the rest of this program because it's fantastic, and I'm saying that, and I'm part of it. But if you're just joining us, we are here with Dr. Yolanda. We're here with Michelle Lake Clark series. We're Dr. Michelle Owens and Dr. Dorothy Loy, and we're talking about mommy time and your health being the foundation for the family, because we are recognizing and we're acknowledging that many times as women and Black women and all women tend to be the kind of the medical directors of their family. And so therefore, but we are also saying, hey, your health and wellness is part of your self-care routine, right? So making sure you have all your screenings done, make sure all your shots are up to date, all of those things. And we're offering some solutions. And one of the solutions that are offered available to you is at Walgreens, and they have a wonderful app that we've learned about tonight. It's fantastic. So I would say go download it. I'm assuming it's on iTunes and the Google Play, just for that plug. Make sure you go download that app, because again, it helps you organize. And anytime you can organize your lives a little bit better, Michelle, you could talk about this as a parent as well. Anytime you can organize your life more as a parent, that gives you time. And that is the one commodity that's very, very finite. We only have 24 hours in a day. And if we can save time, then we can apply that time to other things, whether it's spending time with our children, spending time with our loved ones, but the app does help you do that. Not only does it help you organize your medications and all of these other things, it gives you the ability to chat with the pharmacist, but it gives you your time back to be able to do other things.
Yeah, Ellis, I agree with you. As a mother, right, of a 17-year-old and having to take care of my mother, right? So there's that aspect of also having to deal with your elderly relatives and being more informed about the medication that they have. That way, when you're meeting with them and their doctor, you're informed. So this is a win-win all around.
Absolutely. So that's a great example. So Michelle, you've got a caregiver like Melanie. I'm sorry, Melanie. You've got a caregiver like Michelle. Now she can ask questions about her mother's medication to make sure that she has an understanding of it. So mom doesn't take the wrong medication, take the wrong dosage, and she's got and she can look at on the app and coordinate and add mom. I'm assuming, Dorothy, that she can add mom as part of her family constellation and keep all of those things in order.
Yeah, and she could feel empowered to talk to Melanie about her mom and what's going on. And at that point, Melanie talked about she wants to create that relationship. So she gets excited when you want to talk, Michelle, about you or your mom, and she's going to ask you, how's your mom doing the next time that you walk in? Because she knows that you had questions, and then you're helping manage yourself and your mom.
I think this is amazing, just because as a physician, people come in sometimes having gone to the urgent care or somewhere else, right? So they got care somewhere else, and they'll say, yeah, I was in urgent care on Tuesday and they gave me something, something for pain. And I'm like, what was it? Well, I don't know. It started with a C. I had to take one. And I mean, this happens all the time. And if they don't bring their paperwork from urgent care, I don't know what they're given. So what's great about this is we're always talking about, your primary care physician is your gatekeeper. When you need referrals and all that stuff, everything should go through us. I think it's really a good idea. It's all of this is making me start to think to myself, it's a really good idea for people to use one pharmacy. If you're using Walgreens, right, you're using this one pharmacy, all your meds get prescribed there. You go to the doctor, urgent care, your mom can't remember her meds because she's older, she's having then all you got to do is pull up this app, and you don't have to have the paperwork from urgent care. You could tell me, well, they gave me such and such, and it was this dosage, and this is how much I took. But I just, as a like I said, as a physician, primary care physician, I've always been like, yes, always come to one so that we know what's going on. And now it's like, obviously, like go to one pharmacy, right? One pharmacy chain, whatever that is, make it Walgreens, who has this app, because anytime you go somewhere, you're able to say, I can't remember, but I can pull it up. And then we can actually better care for individuals because we know whatever it is they were supposed to take, it didn't work, which you were allergic to, but you don't remember because it just started with a C, all these things like this, we can actually. So I just said, this is a great information to know.
It is
just like
it is. It's fantastic, because one thing that I'm reminded is that when I go to Walgreens and I go to the pharmacy, there's a diversity of staff behind, and it's so relatable, right? On top of the fact that when we're talking about dealing with medication and communication, this is an opportunity to use the app and to perhaps even be a translator. I know I have relatives who don't speak English. So to be able to use the information and help them communicate more effectively is a win-win.
So as we're wrapping up here with our guests, it's like, I was like, wow, this is This is fantastic. And I'm just going to let y'all know this is real time responses right now because we're really just like Dr. Yolanda was so busy today. I didn't even get a chance to talk to her about the program. But so she was like, what are we talking about? I was like, I said her questions I was going to ask her about health, and that was it. And so she's like, okay, I'm flying blind. And then Dorothy comes on and just starts talking about here's a potential solution that we can have here. And it makes sense. So now it's connecting to those services. Michelle, as a parent, understanding, oh, wow. And as a parent with a 17-year-old child and a mother that she came from, oh, now I can take care of everybody else, makes it more organized, gives it some time back. And I have the knowledge and information and somebody that I can go to if I have some questions about these medications. And so then and we've got wonderful Melanie and Dorothy that have just been fantastic coming here talking about what's going on and what it's like, right? Because we do have to get to know our pharmacists. And I will have to, admittedly, I wasn't all going on. Like I was the grab your bag and go kind of guy. But now I'm like, I might stop and have a conversation because you're right, Dr. Yolanda. It is, if you're going to have a prescription that is going to have an impact on your health, right? You need to talk to the person that's giving it to you, right? You need to have a conversation of the person that's developing it, that's putting it together. And you say, well, can you tell me more about this besides that sticker that's on the side of the bottle? Because that sticker can only contain so much information. But I could talk to Melanie, I could talk to Dorothy, and get more information from her directly, as well as developing that relationship, in the future. So it's just been fantastic. So as we're wrapping up here, Melanie, Dorothy, any final thoughts? And we're going to go all around the room where everybody had their final thoughts about today's program, about the potential solution. There are other solutions out there, but we're talking about a potential solution for you and your family in order to kind of organize your health and wellness routine to make it easier to give you that time back and that peace of mind you have about wellness. So, Melanie, we'll start with you.
So I do feel like just piggybacking on the triangle you said it creates, I feel like developing those relationships, if I see you try to run away from the counter, it's more of like, hey, I haven't met you before. Did you have, are you sure you don't have any questions? Because that'll help us also paint a picture. So if we do need to call your doctor or your doctor calls us, we can have more of a clear plan, and kind of know more about what's going on with you personally, to let them know, hey, were you aware he had an allergy? Or, did you know that he also takes care of his mom and that may be why his blood pressure's up, or anything like that.
Right.
I mean, just things that you may not have, like she said, in the 10 or 15 minutes been able to talk to her about in office. We have a little more time and flexibility to get those conversations from you and to, paint a better picture to help you in the long run with your care as well as your families.
Absolutely. Dorothy?
Yeah, so I would echo that and just, urging you to create that relationship with your pharmacy team members, pharmacists, the technicians, all the people that are there. And then also exploring the app, going in and seeing what it has and what it can do for you. Some people are going to be excited about the fact that they can go in and schedule those appointments for a COVID vaccine or a test when they need it, right? And for some people, it's going to be more about how do they manage their family's prescriptions. And for others, it might be that you want to go in there and use Find Care, which allows you to find a healthcare provider, maybe so you can connect in person or online. Maybe you need some help with finding someone for optical care or mental health. So there's resources in there for that too. And like I said, just knowing that it's a trusted and trusted resource and that there's expertise behind it. And for others, we talked a lot about that chat. So knowing that it's there 24/7. When you have those questions that maybe you just want someone else to help answer and you don't know if anyone else is available, you can go on and use those things. So highly recommend everyone going on and exploring what's available and how it might mean the most to them.
Michelle?
Well, I feel really safe on this panel because I've never been around so many pharmacists and a doctor all in one setting. So that's great. And I feel safe in knowing that I can use the app for many different purposes and share that resource with my family and friends. So I think it's a great tool and I plan to use it.
And Dr. Yolanda?
I just think everything that was said was, in summation, if you will. It's just that, it's really just a responsibility of ours to understand our health and understand that we really are, it starts with us, it ends with us. But the more we know, and the more we understand, the more empowered we are, right? To serve ourselves better, to serve our families better. I just think that for me, learning even this information about what the pharmacists can, and I mean, like, we have great relationships with pharmacists as physicians anyway, but getting families to do more, and to become more, I think, more willing to connect with the pharmacist is just makes so much sense, because we've realized now that we just need we need a team, we need a whole village, right? If I keep saying this, the pandemic has just taught us so much, and I think that being able to utilize these tools, being able to get our kids to utilize these tools, our teens to utilize these tools, and even helping when you say you get your vaccine. Some people, you have your vaccine card, but I can at least remember, hey, I took it on this date. My booster's due in 6 months from this date. All of these things, right? This is just such a good way to track a lot of the ways that you need to care for yourselves, and that you'll be able to care for your family members. So, I'm ecstatic about the now the sort of conversation I'm going to start to have with my patients, and their families, that will actually end up in less phone calls to me at 2:00 in the morning.
Which is always clear. So I wanted to say first, thank everyone. Thank all of our guests for joining us. This has been a wonderful, wonderful conversation. Really kind of the full spectrum. We've got a pediatrician, a bariatrician. We talk about the doctor's experience. We've got a mom that's both a caregiver for her mom and a child. And we had a wonderful guest, pharmacist, here to kind of talk about the pharmacist experience and what they're doing in terms of that triangle. I think that the comment that sums up this really, really well is, Lillian writes, thanks to the entire panel for your time and for the information. I reluctantly downloaded the app to schedule my flu and booster vaccination. So people don't want to get that. So I don't think it has anything to do with the app. But she said it's proved to be very resourceful. And that's one of those things. Sometimes the necessity of getting those vaccines opened you up to a whole world that resources that are outside of the flu and the COVID vaccine shots. And so now you can lean on that app a little bit more. And so I think in summation, what we're really talking about what we're talking about doing here is finding ways to increase your health and wellness outcomes. And this app by Walgreens will help you do just that. So anything we can do, and that's what we're here for at Black Doctor. You can do it, and we're here to help you out. So thanks again for joining us this evening. Thank you all for being wonderful panelists and guests, and we will see you all next time.